Hello, it is Friday, the 16th of May 2025. I think it's a month since I did my last update. This one is going to be quite quick. Um, I've had some difficult times over the last 4 and a bit weeks. I've been having a targeted therapy called regofenib, and or the commercial name is Stivaga, and the side effects have been very severe and very long lasting. So even though I stopped the drug a couple of weeks ago, I'm still getting the side effects. I've sort of got my voice back, but it's still not particularly strong. So the main reason for this update is that tomorrow I'm going to Osaka for a treatment called TACE. It's trans arterial chemotherapy embolization, I think is the word. And this is a treatment I'm going to be having for my liver. And I've been looking into it over the past few months and having various medical consultations. I thought I may be able to have the treatment at the main hospital where I do my chemotherapy, but when I had a consultation there, the radiotherapist said that that hospital is not doing it for colorectal cancer patients, and then he gave a bunch of reasons why he thought it would be dangerous in my case. But then I went back to see another doctor I had seen previously about TACE, and I went through the list of objections that the radiotherapist had given, and this doctor had kind of convincing reasons why these didn't necessarily apply. Now, in my liver there's quite a few liver tumours now. There's 3 big ones on the right hand side, 3 smaller ones on the left, and I think there's some other very small ones scattered around as well. And looking at a CT scan, the doctor could tell he could treat the smaller tumours on the left hand side, but it's not clear whether it's possible to treat the tumours on the right hand side. This is very unfortunate because the tumours on the right hand side are the ones that really, really matter. Not just because they're bigger, but because they are close to my portal vein and vena cava, so a couple of big blood vessels in the liver. I think they're in an area where there's a lot of nerve tissue, which is one reason why I've been getting pain from the cancer for the first time in 8 years, to actually get pain from the cancer. So those are the tumours I really need treated. So when I get to Osaka tomorrow, it's a clinic. Well, it's called a clinic. It's really a small hospital. And they will do an IV CT scan. So they're going to put a catheter in the blood vessel in my leg, and they'll inject a special dye that will then show up on the CT scan when they scan my liver. And they're looking to see where the dye goes, and hopefully it will go in the areas of the 3 big tumours. Only about 30% of people with tumours in that area have this certain required blood vessel for this treatment. So this part of the liver is called S1. This segment of the liver is divided into 8 segments, although technically there are actually 8 separate livers, I think. And there are various common ways that the blood vessels are laid out, and 30% of people have a certain layout, which makes this treatment possible in area S1 of the liver. So I'll find out on Saturday if I can have the treatment on that part of the liver or not. If not, I'll still have the treatment, but it will only be on the left-hand side with the smaller tumours. In a way, it's probably not worth doing, but I'll do it because of being in Osaka at the clinic anyway. If I could check in Tokyo with this special scan, and if I was then told I couldn't treat the 3 larger tumours, I probably wouldn't have the treatment. But yeah, it's probably marginally better than nothing. So in this treatment called TACE, you have it under local anaesthetic, so you're not asleep, you're not even sedated, which I was surprised by, although it makes sense because you have to control your breathing during the procedure. The procedure lasts of 90 minutes to 2 hours. The catheter is put through this blood vessel in your leg up into the liver tumours, and chemotherapy agents are put through this catheter. In my case, it will probably be a mixture of chemotherapies called Folfox, and then also a targeted treatment called Avastin, although I may be able to have one called Erbitux, which I'm a good responder to. Unfortunately, it's the targeted treatment that gives me the nightmarish skin rash. But if I can treat the right hand side of the liver, these big tumours, then I'll definitely ask if they can use Erbitux, because yeah, I would probably get a better result. And then after the chemotherapy agent is put in, some balls are then put in to block off the blood vessels. In my case, they're only going to block the smaller blood vessels for safety reasons. And there are various types of balls that can be used, so metal balls, gelatin balls. In my case, these balls being used are microspheres. I guess it's like a ball consisting of lots of balls or something. And these are going to release some, I think, chemotherapy, maybe radiation over some time. I guess chemotherapy. There's another similar treatment using radioactive balls called Y90, yttrium-90, but that's not used in Japan for some reason. Yeah, so the procedure itself, because your liver moves during breathing, there'll be certain points where you're asked to hold your breath or breathe out completely or breathe in completely. So that's why you have to be conscious. And as I say, it will take a couple of hours. I think it would take 90 minutes if I can treat one side and 2 hours if I can treat both areas. And then you're immobilized in the bed for another 3 hours. So you have this sort of metal leg brace or something to stop your leg bending. Although I've been told you can probably wiggle your toes and things. And yeah, obviously you can't go to the toilet or anything during that time. So you're offered a choice of urinary catheter or some pads. And And then so that will be done on the Monday, hopefully. And if there are no complications, kept overnight, and then yeah, head back home Tuesday evening or whatever. And I've heard you get really quite sick, or most people get quite sick for a few days, so 3 or 4 days with yeah, extreme fever and chills and shakes and stuff. Possibly in my case, that's less likely, I think, because of these microspheres that reduce the chemoregion more slowly, but I'm not sure. So potentially I'm going to be in for quite a tough week. And then a month later I'll do a CT scan to see if there's been any shrinkage. And if there has, probably do it again. It's quite usual to do it so 3 times spread apart by 1 month. Yeah, so we shall see. I am obviously kind of nervous about this procedure. On the other hand, I'm very glad to be doing something that's going to potentially shrink the tumours, because the treatment I was on before, regorafenib or Stivarga, that one, I don't think it's possible to shrink the tumours at all because of how the way it interferes with the cell cycle. It doesn't stop this. It doesn't kill the cells. It just stops them dividing and cloning and stuff. So I'm in a position where I really need to be shrinking the tumours. The big concern, though, is that while I'm getting ready for having these treatments, I can't have the chemo or any other systemic treatments or treatment all through your body. So that basically means that I do have to take this chance and do it. If I get very sick, let's say I wake up very sick tomorrow or on Monday or whatever and can't do the treatment, then I'm kind of in trouble because I need to restart Stivarga straight away, and then find an opportunity in the future to have it again, or to other setup to have it again. So yeah, that's one concern. But yeah, very glad to be doing a treatment that can potentially shrink the tumours. And then also I've spoken to a radiotherapist who treated me quite a few years ago now, in like 2018. So yeah, he says he can treat me again with radiotherapy, using this radiotherapy called tomotherapy, which is designed to minimize the dose of radiotherapy to the healthy tissue. So that's potentially an option for the future. After I've done this TACE treatment, I can go and see this doctor and plan some radiotherapy which would target some lymph nodes and whatever remaining tumours are in the liver. And yeah, that doctor, he's called Dr. Kurosaki at the Edogawa Hospital. He's very aggressive with radiotherapy. So he's chosen to specialize in radiotherapy treatments that minimize the damaged healthy tissue, meaning that you can then use a higher dose. So when I talked to the radiotherapist at my main chemo hospital, he was talking about using 30 grays of radiation with the sort of old style radiotherapy. But Dr. Kurosaki, he could use 50% more, so 45 grays of radiation. That would, yeah, be a significant difference. It's the difference between being able to get rid of cancer and a tumor and being able to just shrink it a bit. Now, shrinking a bit would be better than nothing, but yeah. So that's my situation really. Thank you for all the ongoing interest and support. As I say, over the past 4 and a bit weeks, I've had some very difficult times, usually at night time, when I've been getting the symptoms of a obstruction or an infection, and yeah, I generally try and keep people informed on what's going on, and people have been hugely supportive, sending me messages. So if you've done that, thank you so much. It really makes a big difference because when I'm really ill like that, it's, I have to do things like take a lot of fluids when I'm finding it difficult not to vomit and that kind of thing. So having that kind of support does make a genuine difference. It's not just like how I feel, it's kind of the encouragement actually gets me through it. And so far I think I've had sort of three big scares and it's been okay. If you can help with the costs of my treatment in Osaka, that's incredibly helpful. The actual procedure itself is covered by public health insurance, so I only need to pay 30% of that, although that's still quite a chunk of money because it's quite a expensive treatment. And there are a whole bunch of things that go along with the treatment that are not covered by insurance. Obviously, I've got to take the bullet train from Tokyo to Osaka, and accommodation and stuff. So if you can help out, the donation link, if you can donate, it does make a huge difference. So thanks ever so much for your continued support and interest. Keeps me going when times are difficult, and if you can help out with the cost of the treatment, that's a massive thing. And I'll make sure I do a video soon that is not about my sickness, but other positive stuff that's been going on. So with the cancer NPO and the other patients I've been helping out. So, okay, thanks a lot, and talk to you soon.